Two eminent panelists from the industry. We have Dr. A.K. Singhal. If you can introduce yourself, please, Dr. Sam.
Right. Thanks, Vinayak. Thanks, Pankaj. So I trained as a doctor at All India Institute of Medical Sciences. I did my training as a pediatric surgeon. And then I went to US for training in pediatric urology. Returned back, set up a couple of hospitals, one of which got acquired and one is still running. Then also I delved a bit in telemedicine, set up a company in telemedicine where we were giving remote second opinions way back in 2010, 2012 when there were no apps and broadband was still a challenge. And that company got acquired by 1mg.com. Then I worked with 1mg for almost a year. And now I'm busy setting up my digital therapeutic startup, which is called Fitterfly, where we do remote consultations for diabetes, PCOS, pregnancy, women and child's health. So that's my introduction. Thank you very much.
And there is also a great surgeon. You should talk about that also.
I still do surgeries 1 or 2 days a week. I do surgeries for children with urinary problems, and we get kids from 20 countries to Bombay for those surgeries.
Great. So we also have with us Pankaj. Pankaj is an avid serial entrepreneur who loves making money for investors like us. And apart from him, of course, and he should talk about his interesting journey of being a CTO for certain pharma multinationals of the country, from there to how he got acquired to the first stories. Probably if you can give a small introduction about yourself, Pankaj, maybe next 1 minute or so.
Sure. I would say I've been lucky in my entire life and career due to people like you around me. So I started my career with the pharmaceutical company. It was Ranbaxy at that time. Was part of the technology team, was heading the entire Western region for them, and 3 SBUs which were contributing around 85% of the revenue. Then moved on with a dream that, okay, India #1 is done. We should move to the global #1. Pfizer was #1 at that time. So I moved on to Pfizer and was heading the medical department's technology innovations over there. And after that, again, it was getting less interesting to work on. Then moved on to setting up a company by the name of Bristol Myers Squibb. So they were looking at that was at that time globally number 10. Was part of top 10. So I was instrumental in setting up the entire organization in India. And right from the second employee, we moved on to almost like 150 when I left. And last assignment was with Merck Shop Dom, MSD, saw a lot of mergers, acquisitions over there. And then was being posted, taken up as a regional director. That's where the entrepreneurial bug caught me. And started my first category defining venture, I would say at the time, because nobody was looking at chronic disease management at the time. So I started my first chronic disease company. And from that, I flipped another one by the name of Swastham, which was focusing very much on diabetes. And both were quite early technology platforms at that point of time when few people understood in 2010 what chronic disease management is and how it can be handled. So we made successful venture out of it, and it was acquired by Dabur and another London gentleman. So these were the two, and then now I'm on to my third one, trying to do something in the next space. Again, technology. Love of technology hardly leaves me. That's me.
Great. So we are just about to start. We are a minute away from this. And just to share some of the stats before we start this whole discussion. We are starting live with 32 people, now 34 people rather. And we have almost 250 registrations across 4 countries and particularly 39 cities from India. So there are 92% actually doctors as participants here, and 6% are people from the pharma industry per se. And when I say pharma industry, they are also MRs, they are also stock owners, stockists, as well as senior pharma industry professionals. And then we also have certain banking professionals, as I see one of my known friends have just joined in from Citibank Singapore. He heads Citibank there. So we have people from the financial sector also looking forward to understanding the business possibilities, not just into the medical industry per se, but also in the industry of what we are going to talk in the future about it. So as this is now 2 p.m., we will start with 40 people in attendance. We're starting the session. So first question goes directly, of course, to Dr. Singhal. This is a very interesting question, has been, going on with us for some time. If you can, tell us something more about it, Dr. That a lot of people are saying digital healthcare has become very important in the country. And as this situation of COVID-19 or a pandemic actually happened, and we were forced to go lockdown at home, majority of the people have experienced a very new world of the digital experience and the capabilities what we had created in digital and AI, but was not available with the common people till date, is now available to them, or they are actually being able to witness the kind of depth of services that we can offer. So what do you see the pre and the post, COVID difference in this situation for a digital healthcare scenario? What's your point?
Oh, thank you very much. That's a very interesting question, because all of us who are working in hospitals or leading healthcare companies, we always struggle. Is this a watershed movement for the healthcare? The same way demonetization was a watershed movement for fintech in some ways. Is this going to be a game changer for the healthcare out there? So there are two types of views which persist. One is an holistic view which says that, okay, everything is going to get destroyed, we'll perish. The other view is that change is the only constant. Now, how you can benefit from this change and how you can use more and more technology. Now, if you look at healthcare, I've been a doctor for almost 20 years, and I set up a technology company giving remote opinions way back when the internet was also not very powerful. Doctors and healthcare is generally very slow to change. The regulations, the viewpoint of the doctors, the way they interact with technology, the way the patients interact with technology is very, very different from any other industry. You will see a person transferring money to his wife on a phone, but you will find it very difficult in March, early March of 2020, talking to a doctor on phone. And now suddenly we are in a situation in the first week of May where everybody wants an access to a doctor on a phone. Everybody has Geo 4G network. So I think we are going to see a drastic change in the way the patients and the doctors will start interacting with technology. So pre-COVID era, the hospital was the focal point of healthcare. You need to go to the hospital to see a doctor, to get a blood test done, to get prescribed a medicine you buy from the nearby pharmacy. Though there were e-pharmacies and e-diagnostics available, but 90% of the system was hospital-centric. Now the 90% of the system gradually, at least 50% of it is going to shift to digital therapeutic platforms or digital platforms, which will drive the patient and the doctor interaction and the further systems from there. So I think that is the single most important thing which is going to change in pre and post COVID era. Secondly, people will go to hospital only when required. Otherwise, they used to just go to the hospital even for minor problems. Now they'll think twice before going to hospital. Thirdly, the cost of treatment is going to increase because healthcare workers get exposed to so many people. They will need to buy protective equipment, some of which will be disposable for every single person. So that is going to drive up the cost of healthcare consumption. So these are the three main things which I see happening in the pre and post COVID era, the biggest changes.
Great. Pankaj, you coming from the industry from a very different side of the domain and the side of the table where you see the technology as a technocrat enabling healthcare onto the next level using of AI bots and systems. How do you see what, as Dr. Singhal said, the costs will increase? I see somewhere, of course, the cost of digital space and digital interventions will also somewhere levy on the cost of the overall healthcare costs in the system in the process. Do you see there is a change over there? Or do you see this is something which we will be able to mitigate as a cost? What do you see the digital and the technical part of the healthcare investments pre and post this?
So how I'll maybe put this across is that between the pre and the post, there is a period of the COVID part of it. That's what is going to change or maybe transform the behavior. If you look at the healthcare industry, we have been a laggard in adoption of technology. What maybe a travel and insurance or tourism or all those entertainment industries would have achieved, Healthcare is yet to move there because there is a fundamental change of behavior which is resisting the whole thing. That's one. Second is there is a lot of regulatory environment over there also. And third is it's a doctor and a patient have to sit together, face, and until and unless there is an eye contact between the two, the patient is not happy about the whole thing. So this entire behavior, it will take a while before it changes and it can be shifted to maybe a telemedicine and all that stuff. So while the digital health encompasses maybe the microbots or maybe the artificial intelligence part of it, telemedicine part of it, it's a very vast field to describe digital that way. I would again segregate the whole answer into what changes for patient and what changes for providers. That's also very important to understand. So for patients, I guess the behavior, it's going to be like during demonetization, Paytm moved on with a lot of fast tracking or acquiring of users. There'll be quite a few digital companies in healthcare which will come up, who will be able to grab these opportunities, which will be very consumer centric. So I definitely see a few companies coming up who will be taking a larger pie of maybe teleconsultations, maybe the artificial intelligence, or maybe the data part of it. From a provider side of it, in terms of technological adoption, I see it is going up. We are already seeing a lot of inquiries happening and all, but that is being driven just because of the situation right now. We will have to see how long this behavior can really sustain. Can that entire requirement of a patient sitting next to the doctor and until and unless wo nabs check nahi hogi, tab tak things will not move on. So those kind of situation is something which you will have to really say. Good part is the government is looking at it. It really took corona to happen for government to really wake up and create those telemedicine guidelines today. So I wish these things were earlier. We are in 21st century right now, 2020 year. It should have happened a lot back.
Great. So before we go deeper into this thought process, let me just tell the audience, now we have about 70 people with us. Let us tell the thought process here is that we would be just starting the ball rolling of thoughts among us, and then we'll open it for a Q&A round for everybody in next 5-6 minutes time. And whatever questions you have, you may see there is a Q&A option given in the bottom panel. You can write your questions directly there, and we would try in our best ability to answer them best of possible majority of them. Having said so, Dr. Singhal, now that we have more 70 people and we have actually started our discussions, would you just give a small introduction once again, because in the interest of people, there were just 20 there. We have 50 more people now. So if you can just give a quick 1-2 minute about you, and then we quickly move on to Pankaj's introduction.
Right. So I trained as a doctor from All India Institute of Medical Sciences, and I've set up 2 hospitals and 2 technology companies in healthcare. Just like Pankaj, I'm very, very close to technology in healthcare, and 2 of my companies have got acquired earlier. I still do active practice 2 days a week, treating children with urological problems. And I run a digital therapeutic and a digital wellness startup called Fitterfly. We are well funded, and we are rapidly scaling up in this particular time of COVID. Thank you.
Okay, great. So Pankaj, if you can give yours, please.
Sure. So I am a technological entrepreneur, I would say, mainly in healthcare segment. I've been the chief technology officer for quite a few pharmaceutical companies, started 2 healthcare ventures, category defining at that own time, scaled them up, exited. I'm on to my 3rd venture right now.
Great. So could you just name the 3rd venture also, though we have seen in the posters, so
yeah, so
what it does?
It's very, very interesting. Actually, what we are trying to do is we're trying to bridge the gap of physical and digital without forcing the behavior to turn digital. And as I keep saying, change of behavior is a very, very difficult thing. Asking a doctor to stop writing a prescription and start prescribing and typing and all that stuff is a very, very difficult change to adopt. And we should respect and appreciate that. In certain articles I've even read, is this EMR a biggest disaster, creating the most expensive typist? Doctors are not supposed to be doing all that. They are more productive when they see a patient face to face, when they're writing, when they are, holding the hand of the person and maybe checking them out. So these are, few aspects which we are trying to do. We'll talk about more on this. We are bringing magic into the paper.
Okay. So just a small introduction about myself. I happen to come from a family of doctors. My parents are both MDs in their respective field. And I've worked with closely with one of the state governments as the advisor to the Chief Minister for Family Welfare, Child and Women Welfare for the state. And we had around a few crore people in the state, around 20, 50 plus crores. So you know which state. And then I'm also on the board of DBT BIRAC at one of the systems wherein we are able to select the organizations which come from healthcare and biopharma and biosciences, plant and animal husbandry, and also from the bio defense part of the world. So we do something there. Apart from that, I am currently writing certain new laws for digital health, which is also going to be a part of the entrepreneurship ministry. And can't disclose much, but then we are thinking how healthcare can also be a social enterprise into a profit sector. Why it has to be something which is always taken as, oh, it's a humble and a honorable, noble profession, but why should not it be also a profitable one? Keeping in mind, of course, the social part of it, that if people are not able to pay, they should also not be taxed for it. Which I'm pretty sure all the doctors here would appreciate and understand, that they also would be doing the same. They would be taking care of their poor patients and helping them in the best possible way they can. So coming back to the questions, this is a question which was there in my mind for some time now, and this has been being discussed even in the systems. What is exactly the, Pankaj, this question comes to you, which is exactly the healthcare companies like yours, or you see the industry which is gearing to, what is that you are challenging up to as of today to meet this? If you can please show some light on that.
Yeah, sure. So, look, I think today the good thing what is happening, and even with a lot of support from the government, the good thing is every healthcare individual or a company is being asked to contribute, and there are open platforms where Government of India is trying to gather all those information that how people can really transform and help the situation over here. Now, where we come into play is kind of imagine today you are in a lockdown situation and you are looking for some COVID testing at home to be done. You don't know where to go. You can't move out. You are in a situation wherein you want to consult a doctor sitting at home, but you don't know how to go about it and choose about it. So we are trying to aggregate the providers at one place who are able to be available for the patients at their time, at ease, as convenient and all. That's what we are working on. That's where we have even contributed ourselves to the Ministry of Health. We are working with the government closely on developing a system. We are about having a paper with a doctor, whereby whatever he writes on that paper, it digitizes everything. It's a normal paper. There is no iPad or tablet or anything of that sort. So that's something which we have created, a simple smart paper. Feels exactly like a paper. It's your own paper, but printed with our methodology. That's where we come into picture and digitize everything. So one part is the connectivity in a lockdown situation between the patient and the providers with respect to whatever services are there, definitely. And there is a lot of artificial intelligence segment, which in itself is a different one. But there are people who would want to do, because digital health encompasses a lot of things. It would encompass robot-assisted surgery, AI, self-monitoring healthcare devices, mHealth, big data. So the opportunity in itself in digital healthcare lies huge. And just to add to it, one important aspect over here is the cost part, which Dr. Arvinder also, just touched upon. Just to give you an example, in 2001, Dr. Jakes from US, he was sitting in New York. He did a very simple surgery and he removed the gallbladder of a 68-year-old woman. The patient was in France. That's the difference. And it was done through a robot-assisted telesurgery. Now, the cost of the procedure was not that great, but the legal cost and all the framework, and which the US didn't want to really have it on its soil to be done separately, it costed a whopping 11 million. So while companies and everybody else is trying to do a lot of technological advancement, there is a lot of framework and guidelines which are missing out, and the risk ability of the government as well is missing out at certain places to be able to do that. So that's a bit from my end.
Okay, so Dr. Singhal, what is your take on this part? Because I have now started seeing questions. You will also be able to see them. Somebody just asked a very relevant question. This was Rahul Janak Sinha, who has asked this question, that medical legal implications of telemedicine. And he is suggesting that I have not read it, so probably he would have seen this happening. that medical legal cases, doctors are being ordered by the Supreme Court. Honorable Supreme Court says you cannot look and prescribe medicines on WhatsApp. I just can tell you this, that on a Honorable Supreme Court statement, it is a guideline that you have to keep your medical prescription records for the next 7 years for the matter of course, medical legal implications. So if you can just tell us what is this connect and how this thing is happening.
I think the government has come up with very strong and very clear telemedicine guidelines on how the doctor should do a teleconsult or a telemedicine. And now, following those guidelines, you can very well prescribe any medicine, any investigation, any test. The basic points are you have to identify the patient or the caretaker properly. There has to be a consent which is taken. There is a prescription which can be either digital or a photo taken of a physical copy, or something like which Pankaj's platform generate. That's also okay. So there has to be a record. Of course, it can be digital, it can be physical. And the patient has to have a conversation, identify himself properly, or the caretaker and doctor has to identify himself properly. If you follow these basic steps, the government has eased the telemedicine laws, I think, in one big shot. All those archaic laws of keeping the files for 7 years, all those have gone through out the window. I run 2 hospitals, so we have a big MRD section and we need to keep the records for 8 years, proper filed and cataloged. But I think with the arrival of digital technology, all those spaces which are occupied with these physical records can now be just kept on remote servers, which can be anywhere else. So I think the guidelines have changed and the government has acted very, very swiftly to bring transparency, accountability, and proper thought through process flow to the telemedicine guidelines.
Great, great. Pankaj, this was a very genuine question coming from Babulal. He has asked, what is the security of the patient data? Even that would have been my question, that now that you're saying that you're going to capture the patient's data, as Dr. Also Sindhu said, that your platform does that. If you can just give us a brief of what your platform does and how does the data gets secured. As a doctor, how do I see that data is not cross-shared with some other person, or of course is not made public?
Okay. Vinayak, what I'll simply say is, whenever you are choosing any platform, it is very, very important for anyone to understand that what exactly it gives. Is it going to reduce the risk? Is it going to enhance the positive treatment health outcomes for my patient? Is it going to add convenience? Is it secure enough? Cost reductions and all. And having said that, while telemedicine guidelines are very early, it's very baby steps right now. The framework are yet to be defined, but few things are very clear, that even today, while we are not even in tele, while we are writing a prescription, are not adhering to the compliances which are set out in the government that you are supposed to.
Dr. Singhal, I think so. Pankaj's signal somewhere went down. That's the beauty of the technology that we are all trying to live by so much.
Yeah.
As of course. So coming back to once we will have the technocrat back with the technology, let's have another question coming down, which is asked by Gotham H, which pharma companies right to invest in? Sir, we can't tell you that part. We can't list some of the healthcare companies which are PPE mass suppliers. Of course, we are not the right podium for discussion for that. Probably if you can ask a medical question or a legality understanding, probably we can help you with that.
Actually, there's a very good meme, Vinayak, floating about that. This is a time when a lot of people will make a lot of money and a lot of losses. So both the things are going to happen. The market is going to be very, unstable. So it's better not to invest anywhere.
Okay. So what are the measures taken by the government during this time, and which would be helpful for the digital healthcare? This is a question coming from Vijay Kumar Shipuje.
I think the biggest thing which the government has done is to release proper telemedicine guidelines. Obviously, they are work in progress, but certain progress has been made to assure the doctors how to do proper teleconsultations. And they're even allowed on as simple a platform as WhatsApp. I'll give an example of what we did in our hospital. So we had a choice to go into various kinds of telemedicine platform, and as a doctor, I get about 10 emails every day. A new company which was earlier into just data or into EMR has starting a telemedicine platform. A lot of these telemedicine platforms are not properly thought through. They are not user friendly, and their data security laws, as Pankaj said, also may not be very, very robust. So what the government has done is to frame a guideline which will help the doctor do the teleconsultation. This is very important because lot of patients, if they don't see the doctor on time, even using telemedicine, they are going to miss out on the medicines or the early signs and symptoms of a disease, and it can become very difficult for them. So as a healthcare provider myself, what we simply did was we had junior duty doctors. So patients pay through a payment gateway on the website, and we connect via WhatsApp video call. But there are umpteen numbers of platforms available now which people can use, which adhere to these guidelines. But as Pankaj said, we must talk about the security and the privacy of data of the patient there. Or some of these platforms had a challenge earlier with that particular item.
We got the technocrat back with the technology.
Sorry. Yeah,
Hi,
that glitch
Pankaj.
is always.
That's the beauty of this whole system. We still are struggling world over. So,
That's why
Pankaj, if you can just
long live the paper.
So that's the first thing. This was a question asked by Dr. Rastogi also, that you said this is a magic paper. Can you explain what is this magic all about? We understand science. We don't work on magic. That's a good one.
Sure. No. So and we make science easy as a plain paper. So I'll just quickly explain what WONDRx does. By the name itself, this prescription, we create wonders out of it. So as I said, behavior of a doctor is to write a prescription, and we don't want to move him out, and we still don't want him to miss on the digital benefits what he could have achieved. So imagine a doctor who was earlier writing a piece of paper, it goes out to a patient, and then over a period of time, the retrievability of it, the adherence of it, the compliance to the instructions written over there are completely lost. And the journey of a patient is completely inconvenient. Now imagine a different scenario with WONDRx, SmartRx. So what we do is we customize the paper printing the way doctor would want, exactly what his entire format was. He would put widgets. So it's a paper. It's a 80 GSM, 100 GSM paper which can be printed with a special technology. It gets printed, there's a digital pen, and there is an application. Now imagine doctor is writing on the piece of paper, and whatever is being written, it is instantly getting digitized. And imagine you are sitting in front of a patient and you touch a widget and you are able to show a video to him on the paper. You are able to record your instructions by touching a widget on the paper, which can be further relayed to the patient. So all this is happening from the paper, and what it does is you are writing and you are not losing eye contact with the patient. Very, because the relationship of the doctor and patient is all eye contact. And full digital paper goes to the patient on his mobile along with the physical paper as well. So that's the beauty of the paper.
I would just take a small space with this thought process that Pankaj has just recently shared us a video which we will be sending to all the participants in the video in the webinar here. So if his voice has cracked up, or if you're not able to come in through and understand what you are saying, of course, there will be something that we'll be talking about in the process of it. So you will be coming to know what is this whole WONDRx process was. And last one question before we move on to the next topic. Pankaj, you were talking about the security part of the whole thing while this video got disrupted. If you can tell us, how are you going to keep the patient's confidentiality in the place, and how the data is secured?
Sure. So I would put following points on that. So one is, what kind of servers are you hosting? Is that particular environment where you are hosting the entire data, is it secure enough? That's the first point. Second is going to be whatever is an identifiable data, maybe the name, email IDs, and the mobile numbers and all, whereby you can record that stuff. I would suggest a strong encryption on those pieces as well. Third is the accessibility of that entire data should be only through a encrypted key. So it's like, if you have got that key, only you can decrypt that particular data. And the exchange of information between the patient and the provider can actually be transmitted through over a period of time, blockchains as well, and through these public-private keys as well. So these are few aspects of the whole thing whereby you can enhance the security. Nothing is 100% secure. Let me again, state this. Nobody, even till date, not even Microsoft or Google or any of the giant, has assured 100% security. But the measures to be really making it secure could be always enhanced, and that's what at WONDRx also we have done at our end. We have hosted it on AWS, which is Amazon Web Server. It's pretty strong. One of the questions I saw, whether you can host it outside the country. I don't think the laws allow hosting the patient data of a national to be hosted outside the country, so you have to host it inside. and there are certain HIPAA guidelines which give you some kind of advice on how to store, how to transmit, and all take care of all the data.
Okay. So coming back to Dr. Singhal, there is a question which has come down from a fellow doctor. He is asking a very pertinent question. And I think so. It is Aarti Rajvade who has asked this question. If I'm pronouncing the name, please don't mind if I'm not. How will the hospitals function post June? This is the most persistent question. Of course, majority of the doctors and the healthcare providers will have.
So I think that's a very good question. So I think we'll have to look at specialty wise. Now there are certain specialties which are very, very good for doing a telemedicine practice. Now as a doctor, I think we should get open to the idea where the patients who actually don't need to travel should be managed by teleconsultations. Now some of the specialties which are very good for doing a teleconsult are typically general practice, dermatology, diabetes, mental health, pediatrics, rheumatology. These are very good specialties for doing, teleconsults. So I, as a doctor, my advice would be that, keep couple of slots a week for teleconsultations, and please call only those patients to clinic who really need to travel, because every bit of travel will expose them. And coronavirus is going to linger in the community maybe much longer. Hopefully not, but that will be one thing. Secondly, what I am also seeing post lockdown is over by the month of June, there will be a lot of elective work which will get postponed. Like until it's an emergency, a lot of surgeries are going to get postponed. So for people who are, doing mostly elective work, so probably their practice is going to take a bit of hit. So those are the two things which will be very important for everyone to understand.
Okay, sounds nice. Pankaj, there is another question which comes to you, that all of these digital platforms that are working today are being able to share data across board. How safe is this going to data? Of course, that you have answered, but how well do you see will be able to work across board in multiple types of report sharing and data sharing among the doctors, of course, for a second opinion of things, situations which can be foreseen by doctor.
So I think, and I was reading another similar question over here as well. I would say that first of all, when you're choosing a system, we would want to avoid. So most of the good systems would not allow recording of the video. Right? When you are doing a telehealth, it's a patient's data. It's a very secure data. Even if ABC is transacting and using that particular platform, they should not record that. It's a lot about confidentiality which is there. So any teleconsultation happening through video and tele should not be taken up at all on that. That is one aspect of it. Second, I saw a relevant question on the rural part of it, that how can the the rural aspect can be connected to the urban as well. Now let's understand, 75% of the resources are in urban, whereas 75% of the population is in villages. I think digital health can play a lot of role. We have got enough bandwidth available. There are systems which can work on even smaller bandwidth, and that can really transform a lot of things which were not available for the rural population, which can be connected to the urban. And I missed the other part which you were saying, sorry.
So there are certain data. For example, I want to share an X-ray report or a blood report. A blood report can go for a scan, but how do you share a scanned X-ray report? Do you need special devices to do that? Or there can be MRI reports. So there can be so many other things which probably can be shared on a lifetime, real-time basis. And there are organizations now available across the board in the country, not even only India, but Europe and US, which are able to stream data live to doctors.
Yeah. So
and I think even most of the, sorry, I'll just like to add something.
Yeah, great. Yeah, please.
So regarding these X-rays and MRIs, so most of the scan centers, if you ask them for a JPEG picture of an X-ray, they'll be able to give. Most of the X-rays are digitized across the country. You can carry a USB drive. You can even click a good picture with your camera from the X-ray screen itself. That's very much possible, and that's what we doctors routinely do, consulting each other. Suppose I see a patient whose X-ray needs to be shared with somebody, I just click a picture and share it. Similarly, patients also do. And MRI scans also are able to give these files, which are called DICOM data. You can just click on that, and it's typically for an MRI, it's about 10 to 12 MB file, which can be very well shared with a simple DICOM light viewers are available. And a lot of technology platforms in India which are doing teleconsult, they have an embedded DICOM viewer now in the files.
And that's exactly what I was coming to. So there is a lot of interoperability which is required to be done. It has not reached the stage. So imagine any kind of a machine doing any kind of a PET, CT, MRI, and all that. It should be able to talk to the other system. So there has to be that layer of interoperability, whereby there are a lot of third-party tools which are coming up. They have already done it for larger systems, but I think on a broad basis to have very standard guidelines is still missing out. There are new technologies evolving, enhancing very, very quickly. And I guess once we have those interoperability standards available and some kind of mechanism and guidelines from the government as well, it will be helpful.
Okay. So, Dr. Singhal, this is a question coming from Sam directly with you that, and also probably Pankaj, you can give your take. How do you take care of medical legal issues arising out of the treatment subscribed through digital platforms without examining the patient physically, knowing that there would be an error of judgment not by examining the PT?
I think there your basic sense, or what you call the sixth sense, becomes very, very important. Wherever you feel a little bit uncomfortable that the data of the patient is not complete, or you're not able to do a critical part of the examination on teleconsult, please don't prescribe medicine. Ask the patient to go and see a doctor physically. There are some conditions in which physical examination is mandatory. We cannot skip that on doing even teleconsult. Only prescribe, only write for treatment in those conditions where you're fairly certain of the diagnosis and you do not need a physical examination. That's the first law which every doctor should clearly understand. Telemedicine is an adjunct to, is a complete diagnosis for a lot of conditions, but for a lot of conditions, it cannot be the complete diagnosis in itself, diagnostic way to itself.
Correct. And if I may add, there are certain courses now which are being run by various doctor organizations themselves, whereby how do you really evaluate a person on telephone or on a video to be able to not make mistakes even in those areas where you are allowed to do telemedicine. Leave aside those where you definitely need to see the patient in person. So I guess those kind of courses are also mandated. Even the telemedicine guidelines, if you read carefully, in 3 years time, you as a doctor, you are supposed to be taking some online course to be able to say yourself that I can e-consult.
There's a very interesting question, Vinayak, which I'm seeing,
Yeah,
and this is the common thing which I see with a lot of doctors: how to ensure that data shared on telemedicine platform won't be sold to third party. Now, this is
yeah, I
a
was going to ask you the same one actually. I
no,
was
this
going
is
to come to the same.
so I was a part of a group here which were drafting telemedicine guidelines and how to select a proper telemedicine player. Now, I've seen a lot of news flying around that certain e-pharmacy and certain digital health platform will be selling your data. Now, that's not true. Most of these companies are funded by international investors, which have very, very strong laws and which have very, very strong code of conduct in the way they operate. Now, this is a scare probably spread by a lot of people just to damage the reputations of these internet platforms. But most of the big platforms which are funded by international investors, they are safe to go to. Now, as a doctor, what you should do is you should read the consent which you give when you join the platform, and similarly for the patient. And particularly go to the section where the data sharing is clearly mentioned. As Pankaj said, all the patient personal identifiable data should be removed while sharing the information. And all this should be encrypted and shared, able to be available only through an encrypted key. Most of these consent forms will have this information. And if you don't find this information, then don't sign up with those telemedicine platforms.
This is a question relating to the same one, Doctor. Probably you will answer it from a very different aspect. And Pankaj, I want you to answer from the corporate side of it. How do you see the role of pharma companies now with telemedicine? And will they get into this? Of course, they will get into this. That I can answer. But what will their reps do? This is a very persistent question. I really connect to that because I understand the pains and the future worries that a rep will have if the telemedicine will become the norm of the day. So if probably Pankaj, first you can answer this from the pharma industry side itself.
Look, as I think, and historically, if we have seen, the role of pharmaceutical industry has been pretty engaging in the entire various technological advancements which have happened in the industry across. Now, one of the aspect which the question is being asked is that today the medical reps go and meet. And eventually, if this continues beyond a point, it might slow down or it might come to a halt. And even before pre-COVID, I have seen a lot of hospitals that reps not allowed. those kind of signboards were coming. So these were early warning signs for pharmaceutical companies, and as any corporate would want to achieve and start working on those early warning signs, these pharma companies started working their digital strategies long time back. So around 3 years back, there was not even a digital guy within a pharma industry. Now you would find a complete department in the digital, in each and every major pharma companies. They would have a digital head and they'll have digital marketing managers and all. So they are trying to leverage various channels to reach out to the doctors in the most balanced manner, because again, doctors, as an individual, he would have seen, let's say, 10 reps in a day. But when it comes to digital, he can be bombarded by 1,000 different channels. So there is also going to be a lot of concern from a doctor's perspective that how do you balance that communication, the right communication, authentic communication, and in a very balanced manner. And pharma will definitely lead a role in this. They're already active. There are a lot of things going on around that.
Pankaj, I would like to add something to that. I think, Pankaj, you've touched on most of the points. But Vinayak, what I've seen in the last few days, ever since the lockdown has happened, and as the MRs are not able to visit the hospitals, Pharma has come up with certain innovative digital strategy to, make sure that the doctors are engaged. So we are working with a couple of pharma companies where they're sponsored wellness or immunity programs through Fit of Life for the doctors. And doctors are very engaged. Doctors generally don't take care of themselves. They work very long hours. They don't take care of their health. So we have a specialized health program, a digital therapeutic program for doctors where they help them with their healthy lifestyle. And doctors being doctors, some of them have diabetes, some of them have, with advancing age immunity issues. So we are able to help with them. So that is a very interesting turn which the pharma company has taken in terms of engaging the doctors. Then I also know of 5 or 6 pharma companies which are also rolling out telemedicine platforms, helping the doctors to do teleconsults. There are a lot of webinars being organized. My wife is an ophthalmologist, and she says in ophthalmology on a daily basis, there are 20 webinars happening. So it is like death by webinar, which is actually happening these days.
I totally agree. Totally agree.
And then finally,
So
another thing which is happening is a lot of pharma companies are actually doing good work around updating the knowledge of the doctors. So a lot of doctors, if you look at in tier 2, tier 3 cities, they have such busy practices seeing 80 to 100 patients, sometimes till 8 or 9 in the night. Now these people are really engaging on some of these knowledge platforms and updating their knowledge, updating the latest guidelines, reading them. So I think there is a certain reboost happening in terms of latest guidelines and doctors adopting them. And this is very well supported by the pharma companies. So they are not sitting idle.
Of course, as you rightly said, death by webinar is happening all over. A lot of people are really crazed out. While being in this session, I got a reminder of around 9 webinars which I've missed somehow.
There are a lot of memes also. There are a lot of memes going around.
Very true, very true. The best one being Alia Bhatt's meme that I don't want to go to a webinar. She's crying it out.
Yes.
That's a true one. So coming back to this, there is one very intriguing question which I found it to be: how doctors who wish to pursue a career in the digital healthcare domain go ahead. Comes from Naresh Jamani. If you can answer that, probably Dr. Singhal.
So I will be a primary example of a doctor who trained as a super specialist doctor, trained for 13 years to do pediatric urological surgeries, and still went into digital health. So I think it's very easy. You first need to start reading about the basics of technology, how it works, and it can be starting as simple as learning how to make your own website, learning how the design framework of a particular software works, then go on to understanding how certain platforms or certain things are designed in the way it's called user design or user experience. Then the best way to get into digital health is actually work with the company which is into digital health, either as a content writer or as a medical program manager. And once you have a little bit of knowledge and you like that, you enjoy this, because if you're trained as a doctor for 8 or 10 years, some doctors do not like that kind of environment where they are not the commanders of the ship. If you look at the typical doctor attitude, when you're in a hospital, you're the boss. Everybody looks up to you. You can do anything. But when you go to digital health, you really start at the bottom of the ladder in some ways. You don't know much about technology. You have really spent all your life seeing patients and in clinics. So it can be a little humbling experience, but it can be very rewarding as well, where you can go and meet amazing people like Pankaj and set up companies as well with them. Have a good partner with you.
This is a question coming from Devasis in connection to what you just said, Dr. Singhal. He has asked a very touching point here. A lot of telemedicines are now highlighting their own features. How can we select the best one and on what basis? Of course, on what basis is something, as a doctor and Pankaj as a technocrat, we both could answer. But I feel there is one thing important that has to be also mentioned here, which is on what legality of ground that you should be doing this. That's something very more important when you're talking about it.
So the answer will be from two perspectives. One is the ease of use. I think that is the most important factor in choosing a telemedicine platform. How easy it is for you. And remember, you as a doctor may still use it. But what about your patient? Would they be able to pay easily? Would they be easily able to do everything at one click? Is it going to be very cumbersome for the patient? So the user experience becomes the first and the foremost things in this. And the second thing is around legality. Make sure that you do everything right from your perspective, which is identifying the patient, taking the consent, doing all those things necessary, and refusing certain consults where a physical examination is required. I think that is where most of the legal part is taken care of. And the last most important part is the security and privacy of your data and your patient's data. So once you find a platform which matches all these things, then you go ahead with the platform. I recently conducted a technical due diligence for 3 telemedicine platforms, and they were great platforms, but they were so difficult to use for the doctor and the patient because they were made by somebody who was not actually seeing patients. So I think for creating digital platform, you either need to have a huge experience of having worked in the healthcare, or you should have a doctor, somebody like Devashish, who's your partner in designing that experience.
Yeah, exactly.
Pankaj,
Yeah.
Pankaj, what's your take on this?
No, I would absolutely agree, and Dr. Arvinder has covered most of it. So as I said, initially also, you need to have the right experience to be able to define the right platform. It's not about creating a platform which is superbly, having hundreds of features, but hardly 2 are put to use. So you need to look at first as ease of use. After you have evaluated who's the guy behind developing it, what's the platform's efficiency? A lot of times people use cheap methodologies of video consulting platforms which are available because they'll come cheap, but the efficiency of the whole thing will not be good enough. So you would want to even understand what the kind of video tele platform which you guys are using. Is it efficient enough? Is it able to stream the data on a lower bandwidth as well? Right? Whether it is contextually rich in features to you, not contextually rich in features to their selling pitch. How does it take
Pankaj,
care of? Yeah.
Pankaj, there is something which is also a connecting question here. Somebody asked that if I'm doing this telemedicine stuff, this was a very important one. That will I be able to save a data from a WhatsApp? First of all, saving a data out of WhatsApp is not legal in this country as of today. So please don't try that. And taking your own personal data for your own personal use is completely allowed. You can always have your own data, but then keeping it for a medical reason or for a commercial reason or for a reason of knowledge without the permission of that individual is of course not allowed at any point of time. You can't even record a phone call for that matter. So here is something, Pankaj, that if I want you to please also just add this point of, as I understand, your company is also able to do something in terms of recording the data. So how do you legally do it, and how does a doctor share it with a second opinion? At the same time, what does it happen to the industry which is not related or compiled with the legalities? Because as I understand, the medical industry fraternity is exactly highly challenged with the medical legal cases while they are challenged with saving a life at the same time. So how does this whole thing work, and how are you able to safeguard them to your of ability in your?
Yeah, so at our end, what we do is none of the data gets transacted on any of the open platforms. Not even the doctor can himself download the data on any Excel. So we make sure that the platform is there, and even if there are certain transmissions of data going to any third party, it is encrypted and there is a key floating around with it. We also ensure that any consent of the patient, an explicit consent of the patient is taken, even if the data has to be shared with any concerned third party. Let's say maybe the doctor would want to refer the patient to another hospital, but it should not happen without the consent of the patient again. So these are the few things which are from a technology and a guideline perspective we can look at, that data transmission has to be secure. It should not be on Facebook, WhatsApp, and other any open platforms. It should be on end-to-end encryption. Second is the guidelines have to be followed. One of the major one is that an explicit consent must be taken from the patient before sharing your patient's data with anyone else, whether clinical reasons or non-clinical reasons as well.
Okay, so here is a quick question, Doctor. Probably you can answer it this well. What are the telemedicine, usage as well as softwares, or as well as capabilities, or as well as usabilities for the field of pathology and the field of dentistry?
So pathology is actually very, very advanced, and if most of the time in US, the full cancer care and neurological and rare diseases care is completely on telepathology platforms now. And in fact, telepathology platforms have become so efficient that they have a lot of artificial intelligence embedded them, which can actually flag off a lot of slides at one go. There's a big startup in India called Niramai and also Siktapal, which have completely digitized the, you have an
Yes.
investment in them.
No, I'm on the board of Niramai in terms of advising them to the next level.
Right.
And
So I
I
think
selected them in Bayrak.
perfect. So yeah, so I think telepathology has moved leaps and bounds when it comes to pathology per se. I think telemedicine is the way to go in pathology. But for dentistry, it's still a challenge because dentistry, it is very difficult to take those images inside the mouth, and still somebody needs to do it properly to be able to send. And secondly, even in dentistry, there's a lot of clinical examination value which is there. So my knowledge regarding dentistry and teledentistry is relatively limited, but whatever I've known, couple of my brother-in-law is a dentist and he has a big practice in Delhi, and he is struggling. He says patients keep on sending me pictures of their mouth and inside of the mouth asking for prescription, but I find it very difficult to give them any kind of advice regarding from that.
Okay, coming quickly to a very short answer, probably yes and no, we can quickly move out because this is a very generic question, but then important one. Is sending prescriptions on WhatsApp safe?
Yeah, absolutely safe, because if you have sent your taken a picture of your prescription and you've clicked it, you can very well send it to WhatsApp. It's absolutely safe, and WhatsApp is actually third-party secure also. It's a very secure platform.
I'll just add to the legal part of it. If it's a doctor sharing a prescription without the patient's knowledge, that is not allowed. It
No,
has to be consent
sending to
and
the
allowed
patient
from both
only.
sides.
Yeah, it's for
Yes,
the patient who has done a consult with you.
correct.
Yeah.
So at any point of time, any conversation, any documentation being shared among people or recording being done among people, even video recording, if it is being known and aware to all of the parties concerned, then it is completely okay and legal to do that.
So
It
there's
should
one
not be
very
done hidden.
Yeah, there's one very interesting question about user satisfaction factors between traditional practices and digital practices. So I think from India, the data is not available, but there's a lot of data available from the largest teleconsulting practice in US called Teladoc, where they have for at least 16 common primary GP diagnoses, which account for almost 60% of the hospital visits. They're able to have equal satisfaction scores between telemedicine and traditional practices. It may not be valid for a lot of other specialties, but for certain common symptoms and common primary GP practice, it's equally effective. And within India, it remains to be seen. India is a very touch and feely society, and in America, technology usage has always been high. Distances are long, doctor appointments are difficult to get, and doctor appointments are expensive also. India, the healthcare is cheap, doctors are easily available, and we are very emotionally connected to feeling and seeing the doctors. So probably the satisfaction scores in India will be different, but it remains to be seen.
Pankaj, this comes to you. Are there measures that can help a clinician track his or her own competencies in offering telehealth? Comes from Dr. Rupa Srinivas.
Sorry, please come again.
Are there measures that help a clinician track his or her own competencies in offering telehealth?
So I would say that a lot of measures definitely you can, whenever you are digitizing any form of data, you will be able to go and look back at the same data while you are not doing it through any digital help. Like you're writing on a normal paper, hundreds of prescription given, any kind of efficiency or any kind of data insights would not be visible. Whereas whenever you are moving to a digital health, you will be able to have a lot of measures set in for yourself. I can't even define one, two. There could be hundreds of efficiency measures which you can define moment you move on to any digital platform, whether it's a digital paper, whether it's a digital tab or a computer laptop based.
Okay, this question comes from a very good point. Just a quick answer would do. Are the dentists also considered by Ministry of Health as registered medical practitioners, RMPs?
Yes.
I guess so, yes.
Okay, as per my understanding, all of them are if they have passed out from a legal authorized government institution, which has the
Yes.
validated answer to give a degree. Coming back to this, there is a question from Dr. Nidun Jacob, founder of Zippur Health. Um, what are your thoughts on online procurement platforms of medical devices and supplies for healthcare providers, and what do you feel are the pain points in these areas in procuring online?
Um,
Yeah, go
Pankaj,
ahead.
please go ahead.
Okay, so no, I said there's an amazing future for this. Believe me, on a lot of these procurement-related platforms, I'm sure things will move on. You have to just get the right knack of it, because today, not only these kind of situations, even otherwise, the transition, as Dr. AK said, that transition from hospitals to platforms is going to happen, for the patient. Similarly, in the buying behavior also, a lot of transition would happen onto online stuff, because online will always be able to give you better transparency and price visibility. Few challenges which you'll definitely face in this is going to be your price competitiveness, your distribution channel, how you are able to reach out to every single individual who is willing to buy a product out there, your own marketing skill sets.
Okay, so there is a question coming from Dr. Dinesh Agrawal. How do you handle staff salary these days? This is not a technical question in terms of medical sciences, but it's a very, very important, persistent question. So probably, Dr. Singhal, how are you handling it? Probably if you can share some light on that.
So I have a total of 200 staff working in my 3 companies, and the situation is different in 2 companies versus the other company. Now, when I talk about the physical hospital, ours was mainly both the hospitals were elective surgery hospitals, and the work has completely, like, virtually come to a standstill. And the nurses and and the ward boys and the doctors, the junior doctors, can themselves see that the hospital is not earning revenue. So actually, we sat and talked to them, and they are okay to take a haircut of almost 50%, and that depends upon also the grade of the employee. We've assured a basic minimum for all the employees, and the people who are senior, they've taken a larger haircut. But when it comes to my digital health company, Fitterfly, actually we are seeing a lot of interest from people having diabetes, women undergoing pregnancy, and people with PCOS. So actually we have signed up a lot of contracts in the last 2 weeks itself. I think the big contracts, and because of that, we haven't done any salary reduction at Fitterfly at all. And the beautiful thing is, we could actually make our organization leaner. I had 3 floors for my organization. I let go of 2 floors because I could suddenly see that all my employees in the digital health company can work from home. There is no need for them to come to the office actually. So I think there are 2 dimensions to health. So the companies which are low on capex do not have much rentals to give, and the work can be completely transferred working remotely. Those companies can stay productive, and for them, they should try to give their employees whatever best wages they can give. But where employees can actually see in a physical hospital that there is no revenue coming, they will need to talk to the employees one on one and ask them to stand up for this particular time and help out the organization.
Okay, this is something that has been a question from again and again from certain people. They were asking about WONDRx, so they're asking about the product or the system and the things that you talked, Pankaj. So we have been answering them on your behalf that they can reach to us so that we can able to get you connected to them. And we will of course be also sharing the answers and the questions with all the concerned people who wanted to know more about this. Coming back to the last few questions, because we have 7 minutes left in the whole discussion, and we have some 35, 36 questions open till now. So how effective is this whole process? We have been answering this regularly, so let me just skip this question, and we will try to skip as this model. Somebody's asked this question: do you see this as a good business model to reach out to schools post this pandemic situation is over, as a pre-health checkup thing? What would be your take on that, Dr. Sindhu?
So I used to run a company which was into school health checkups. I ran that for 2 years. Now schools are very, very difficult organizations to work with, and none of the companies which have worked with schools on health or any ancillary services have been able to scale up. And there'll be a lot of resistance from the investors also if they want to invest in a company which is dealing with schools. Schools are going to face another a lot of existential challenges because of COVID. They will one of the first few businesses which will start suffering. And I can already see that government is coming up with regulations of not paying fees or delaying the salaries and all those things. So I think it's not going to be a very good segment for the next couple of years to work in.
Okay. So just one question quickly to take it up. Pankaj, this is a question coming from Nanduri Suresh. As a doctor, if we adopt digital practices, sharing the RX through WhatsApp or any digital form, is there a chance of losing the revenue for the pharmacy, or do you see we can overcome this or minimize this?
How is the so I didn't understand how the pharmacy
So
involved
I
in
think so.
this.
Coming from the background of the doctor's question here, this would be that they would be having an internal pharmacy at their own nursing home or hospital, and they would be concerned that if sharing the digital information with the patient directly on a WhatsApp or other digital platforms, will that change in their selling
Okay.
or
No, so
capabilities with them?
definitely, if you are using those open platforms which are not connected to your ecosystem of fulfillment, you are definitely going to lose revenue on that. And that's where I would add another point to WonderRx. When you write on that digital paper, on that smart paper which you write, we also give you a connectivity to your entire ecosystem so that you can connect your patients with that ecosystem of yours, whereby convenient and reduced deliveries can be done for the patients.
Oh, great. So, if patient call and connect the doctor rather than the doctor calling the patient via telemed, by any available social platform or through specific telemedicine platform, do we still need a consent? Since when a patient initiates, it comes from under implied consent, as in understand. Please clarify.
I
Comes
think the
from Vivek
consent still needs
Gopal
to be
Krishna.
taken because the call may be for something else rather than a consultation. So you need to very clearly say that it's a consultation. I'm so and so. That needs to happen.
There is was two couple of questions here, Dr. Singhal, that you probably will be the best person to answer. How do you ensure the doctor gets paid on an e-consultation?
So at our hospital, we have our own payment gateway, so that's not a challenge. And whenever I do e-consults, I've been doing it for last 10 years. I give my bank number and I do the consultation only after the payment has been done. And I think a lot of other platforms run by third parties and e-pharmacy players also have a payment feature in them. So I think the early days when the internet banking or internet payments were not so good, there were a lot of challenges in delayed payments or not coming on time and stuff like that. But with the current systems and the CRMs in place, I think it's not a challenge anymore.
So you
So
always choose a platform which has got a payment gateway
yeah,
normally.
payment gateway. Yeah.
So we have one common question coming from a nutritionist. Two nutritionists have asked the same question. How do you see the digital platform helping them in the consultation process? Probably Pankaj, if you can answer that from the technical side of IT.
So I guess this is something which again will have a very nice and positive impact on the dietitian field, because you don't need to really go into too much of face-to-face stuff. The kind of digital consultations or e-consults for dietitians, for probably psychologists, counselors, these are the things which I believe is just a mindset change, and definitely it can be done remotely on lot of cases. Depends on what kind of dietitian you are and in what all category you have been trained on. Basis that, I think a lot of good revenue optimization can happen from
And I
Dr.
would like
Singh,
to add something to that, Vinayak.
yeah,
Sorry.
please, please, please,
I
please.
run a company which is primarily employs dietitians and coaches for disease management. So we work actively with patients with diabetes and also women having pregnancy or PCOS, and they are mostly dietitians, masters. What we have seen is that patients are very happy and willing to engage with dietitian remotely, as Pankaj rightly said and predicted, because clearly there is not much to examine. All you need is to understand the disease of the patient, the requirements, the kind of cuisine which they eat, and we have our own software which is called Intuitive, which these dietitians use for sending messages, doing consultations, doing dietary analysis, making diet plans. So I think dietary consultations and nutritionist platform is something which can be very easily done remotely using telehealth.
So what are the other, Doctor, what are the other specialities which are best suited for telemedicine then?
Actually, that's a good question. I made a full list from US and India, which there's a lot of data around it. So general practice, dermatology,
there.
diabetes and endocrinology, and then psychiatry, mental health, pediatrics, rheumatology, immunology, infectious diseases, and radiology and pathology. So these are the 8, 9 specialties which almost 80, 90% of the work can move to telehealth. Then are other specialties which find a lot of issue, and there was a question around ophthalmology also. So ophthalmology is something where a slit lens examination or a close examination needs to be done. There are new devices coming which can examine the retina and the image can be sent, but still you need to go to a physical center. There is an app now available in iPhone where you can screen the retina, but that is not very accurate. It can be good as a screening purpose. So ophthalmology certainly faces a lot of challenges. Similarly, orthopedics, ENT, dental, and general surgery. So these 5, 6 branches face a lot of challenges when it comes to, in my assessment, in all these specialties, not more than 30-40% of the consults can be done online. But patients who have already seen you in the clinic and they need to come for a follow-up, that all can happen using telemedicine.
Great, great. So just coming to two last questions, which we'll be closing this whole seminar discussion modes would be. This is a question which was for the some time and has been coming up again and again. What is the difference of satisfaction factor when it comes from a traditional practice vis-a-vis digital practice when you see this? But probably Dr. Singhal, you can answer this, and then Pankaj, you can also give your take from your industry aspect.
So
And
actually,
one more,
yeah, sorry.
and one more aspect to this, adding to it, which I had a question of, that what happens if you are able to consult a patient to a maximum extent, and still the patient wants to meet you but is not able to do it? Then how do you extend the physical part of the consultation via this whole mode of all which you are running as a current mode today?
So I'll answer the second question first, because this situation has been arising in my practice for last 7-8 years. So get a lot of consultations from children from various parts of the world where they need an examination. So typically ask them to go to their pediatrician, and the pediatrician records a short 10, 20, 30-second video doing an examination, and they send it to me through an email. So you can go to your local doctor if the doctor you do teleconsulting, if he's a specialist or far away, then you can probably go to your local doctor, get an examination done. Secondly, sometimes what we have also done is we have given the patient certain thing to do and record a video of that and send it back to us, which acts as a surrogate kind of examination which can be done. And the first question, can you repeat it again, Vinayak? Sorry.
So the first question is, what do you see from the traditional practice to the digital practices? What is the difference that you see?
Pankaj talked a lot about eye-to-eye contact. I think with good video and good internet, you can establish eye-to-eye contact. And for certain specialties, I think in the coming few years, with the scare of COVID, expensive transport, parking, time wastage in doing all that, I think the satisfaction scores for certain diseases will start reaching the traditional practice. But for certain things, it still may not reach.
Okay, so Pankaj, what's your take on this?
Yeah, so I would say one of the satisfactory factor would be if you can, doctors can reduce the cost of consultation while they are on leave. That'd be one of the best one, because, if you imagine a traditional wherein you have to set up a clinic and do all that, imagine you're sitting at home with just a payment gateway and a laptop, definitely your costs go down. And if you still want to see some patient, there are Starbucks out there. You can always do that. So imagine
on the doctor's behalf, I will say this is a situation of Picasso doing a painting. Whether he does it on a sketch or on a paper, it still will cost you the same, because it's a Picasso's knowledge.
Exactly.
Not the environment that is going to hit. Okay, so there is a question Dr. Akshay P. Jadhav had. Challenges for a patient to combine the prescription, lab reports, radiology reports, etc. into a different case history. Probably he's trying to understand that how does he do that. So very quickly, on the behalf of saving the time and going to the last question before we close this, is that WONDRx, as his software, as Pankaj has explained, is able to merge all of these data into one box of service and information, along with the audio clip of the consultation which was being done with the patient and the doctor in one space for the doctor through his app, which is an indigenous app, patented technology done by them. And probably, Dr. Akshay, we will get back to you probably more with the Pankaj on a one-to-one. So probably, Pankaj, then you can take this up on an individual basis.
If I may just quickly add, because there were quite a few questions which were related. So as WONDRx, because we were being asked on the questions, a lot of it. So we've got 3 products. One is the smart paper, which doctors can use, continue to write, but it will be as digital as any other platform through the paper. The second is wherein we are giving all the providers, whether it's a physiotherapist, dietitian, counselor, psychologist, everyone to come on board on our platform and be connected to the patients. Now, this particular feature is going to get launched shortly as well, whereby, if you have, as a patient, I have to find a dietitian, where should I go, or a psychologist, and also we are aggregating all that. We have quite a few questions on that as well, and which includes e-consultation probably down the months towards that.
Pankaj, just add one more point to this before we take the last question, because there is a very connecting question to it. If you want to take telemedicine to the rural belt, what should be the beginning of doing that? What should be the first step in doing telemedicine? Probably Dr. Singhal can also throw some light on that quickly, and then we'll take the last question and finish.
Look, from a technology perspective, nothing much would change. You just need to have a good system at your end with some good cameras, low bandwidth, capable stuff. And then from an execution perspective, I think you would, from a village perspective, you would want to go to the local panchayats and all, which are going to be facilitating all these kind of stuff. So I guess there are quite a few companies in FMCG sector who are already doing this, wherein they have set up a lot of panchayats and all these kind of systems, which can be even acting as your e-consult platforms as well.
Okay, so to the very last question before we wrap this up, Pankaj and Dr. Singhal, thanks a lot for sharing such a knowledgeable thought process of whole concept of the telemedicine as well as the future of the digital healthcare industry. What is the best way to reach out to both of you? Of course, a lot of people are asking this, so we'll be sharing them the email IDs of what you would like to share with them so that they can consult with you on one-to-one, maybe through e-mode. But having said all of this, do you see India, which is not so much of a literate country, and we have majority which is still not able to understand English as a language of communication, will be able to take it from the patient's point of view when it comes to the telemedicine benefits, advances, technologies, or even basically understanding? India as of today in the mobile phone industry is 126 crore mobile phones, which are smartphones. But the fact is we have a 3.2%, 3.2x of people using mobile phones. So majority of people have two phones, which means a majority of Indians, around 50 crore people, do not have a smartphone. How do you see that they will be able to understand, emote, and able to take up this whole challenges of telemedicine from the patient's point of view? What you see to make that simplified? Both of
So
you
I think that's a wonderful question. I think where some of the people have two phones, but the opposite fact is also true. In a typical family of 4 or 5 people, only one person may be having a mobile phone, which is good enough to give access to the whole family for a telemedicine consult or a telemedicine platform. And the second thing, India is a land of diversity, both from language as well as cuisine and everything else which we do. So the telemedicine platform should address at least the top 10 or 12 vernacular languages, which becomes very important. And similarly, the content which we push out for health should be in multi-language format. So I think if you take care of these couple of things, I will see that India has leapfrogged the a couple of things which the Western world couldn't do. Similarly, I'm very sure that Indians would be able, both the doctors and the patients, would be able to adopt digital mediums very fast, and we will get surprised.
Great. And what's your thought, Pankaj, on this?
If we can add the vernacular part to it, in all the e-consultation stuff, and there are enough systems coming up, I guess the problem stands resolved to a lot. So from an infrastructure wise, we are already going good. Dr. AK said that we still have a phone, at least one. And even in village, we will still have a few. I remember days when one tower, one village, and everybody was onto that speaker phone on that. So we're still in a far better situation. So if we are able to get from English to a vernacular kind of a stuff, and we can have more apps doing that, that will help a lot.
Yeah.
Okay, thanks a lot, Dr. Singhal and Pankaj, for this excellent seminar. We, in this short span, answered 70 plus questions, and there are 10 or 15 questions rather still open to it. But in the interest of time, which I understand is very short at hand with us, we've already overshot by 10 minutes. We will try to answer them through sharing these questions with you, and probably you can write this to the people individually who have asked these questions. That would be a great help. Thanks a lot once again, and thank you everyone for joining us for this excellent webinar.
Get ready for the wonder.